As you saw on the screen, Spanish speakers are invited to tune in to 104.1 La Mejor in Santa Rosa, where we have simultaneous interpretation of the show in Spanish. First up, Susan Gorin, chair of the Sonoma County Board of Supervisors. We talked with her Monday morning as this incredible week, and now it's only Tuesday, was starting. Here she is. Good morning, Susan.
Good morning, Steve. It's great to have you here in my remote office.
And thanks for joining me. I'm going to start right away with a question. What is the county doing to ensure that the most vulnerable are protected from financial distress, including low-income workers, agricultural workers, including undocumented workers, and people with small business and in the gig economy?
We are in week 2 in our sheltering in place order, and we will be coming forward this week for an extension of the sheltering in place order. And we will be having even more specifics about what are essential businesses and what are not. So check your socoemergency.org for an expansion of the frequently asked questions as we go forward into this week. This is the week when people are really starting to panic about food security and how they're going to stay sheltering in place if they are not having income coming in, especially those folks who are in the hourly economy, the vineyard workers, et cetera. And our heart goes out to each and every one of you who received the layoff notice. We did take the action last week to put into place an eviction defense ordinance so that if in fact you were laid off by COVID virus by your employer, you can have that ability to work with your employer and not waive your rent responsibilities, but at least delay them until June 2nd, or it may be longer, we're not sure which. I know I've received a lot of concerned emails and telephone calls from potential landlords. They're concerned about how do they maintain their house, but I think there are resources available, and we're working to expand those resources for landlords so that they don't lose the rental house in which you're living. But I think the anxiety in the community now is focused on how do we feed families. The county is moving forward today in affirming and signing the contracts with 5 different food service providers, including the Redwood Empire Food Bank, Meals on Wheels, Ceres, and a couple of more, to really make sure that we have food security for our entire county. And we're moving forward in reaching out to each of the communities with your service providers in the communities to make sure that these food providers connect with you, connect through your service providers to ensure that you have the meals. And I know we're getting a little off track, but this is very important. We're working with many service organizations and potentially including schools to ensure that our families are identified, making sure that they have access to food, whether it's delivered to their home or driven up. Sort of opportunities for those folks in our community. We're also working with them to compile or bag enough food for a family of 4, for example, for 3 or 4 days so that you don't run out of food after day 1.
Thank you, Susan. Now, let me just, I assume, other than the fact that our undocumented neighbors won't be getting checks from the government, and this is sort of a yes or no question, everything else that you're talking about is going to be fully available to every single member of our community. No one is going to check your papers, you know, as they say, when they deliver food or anything else. That's a yes, I hope?
That absolutely is a yes, and I want to ensure everybody in our community has access to what they need to remain sheltered in place and to ensure that their families are fed during this pandemic crisis.
Good. Thanks. Here's another question, again, along the lines of food and groceries. As you rightly note, people are concerned about this. Is there any way that someone could organize a day or 2 days a week so that small orders from the grocery store can be ordered by persons who are isolated in their homes, in a street or in a neighborhood, and maybe they would come and have a drop off in the neighborhood, or perhaps close grocery stores except to deliveries. Low income and seniors could have a lower delivery charge. And this is from a couple. My husband and I are 77 and 81, and we don't want to risk going outside. So what's your answer to those folks in our community?
I want them to be safe. I want them to remain shuttered in their homes. There are grocery stores that have senior hours, and you can readily find which ones do have senior hours. They're usually earlier in the morning for those of us who rise early. And there are grocery stores that really do employ safe practice and safe distancing. I know that one of the grocery stores I visited recently has a capacity limit. So as one person leaves the store, the other people can enter, and you have to wait in line at a safe distance. So choose those grocery stores that actually do employ senior hours and safe distancing. But really, truly, the answer to your question is, how do we get meals to you and groceries to you? First of all, you should sign up for the Meals on Wheels. Through the Council on Aging, they can deliver prepared meals to you in your home. And Meals on Wheels, Council on Aging, is one of the food contractors that we are contracting with at the county. So they're prepared for your calls. Please sign up for the meal delivery. I've talked to many in the past, and they find that those meals are actually adequate for a couple of different meals and not just one. So please outreach to them. They're an important opportunity for you to have food security.
Okay. And for now, here's the final question. How long can we expect the schools to be closed? I'm certainly happy to keep my family safe, but I just need to start, making plans for how long this is going to last.
I think that's the question that our entire county has, maybe even entire country has. I know that some of our leaders have suggested that we can stop our sheltering in place within a few weeks. I really want to say that we're going to be in this for a longer time period. The schools have suggested that they are going to be shut down until May 1st. I wouldn't be at all surprised if our schools are closed through the end of the year. This is really
the end of the school year or the end of December?
Thank you for that clarification right now. I suspect it may be to the end of the school year.
Okay.
And I'm hopeful that it's not to the end of the year, because we're going to have a lot more issues that we have to deal with if that happens. But I'm looking at the Spanish flu epidemic and recognizing that Sonoma County had to button down for about 4 months to stop the spread of the flu epidemic.
This was
from
1918.
Decimating our younger people at the time and our strong, vibrant workforce. That affected different parts of our community than certainly what we're seeing now. But if you look at the demographic data that's now on our SoCo emergency dashboard, you will find that the middle-aged folks are also being significantly affected by COVID. It's not just the over 65 with underlying medical conditions. So that is why it's very important to be safe, stay sheltering in place, take this seriously, be patient, social distancing, and use those frequent breaks to walk around your block, wave to your neighbors at a socially responsible distance, and please, please stay safe in your home, work remotely, learn about technology. I'm finding that I'm staying connected better with folks in my community using the Zoom meetings and Skype meetings, and actually reading stories to my grandchildren in Colorado. So there is a way, but we do have to be patient and recognize that as horrible it is, we can get through this. We will get through this and survive better than ever.
All right, Susan Gorin, Chair of the Sonoma County Board of Supervisors, thanks so much for joining me.
Thanks, everyone, and I look forward to chatting with you next week for another set of questions.
Okay, now we're very lucky to be joined by Lisa Carreño. Lisa is president and CEO of United Way of the Wine Country. She's also on the board of
Los Cien,
Sonoma County, and absolutely also helps us run the 211 service. So we're going to be talking about all of those things together. And Lisa, welcome to you.
Thank you. Thank you for having me.
All right. First, let's start with the fact that you're president and CEO of United Way of the Wine Country. That sounds like a big job.
It is.
What do you do in that job?
My role is to work with the community of our staff, our board, strategic partners in the community, public sector partners like the County of Sonoma, the City of Santa Rosa, all of the cities. And actually, we are a 5-county United Way, so we serve the geographic region from Sonoma County up to the Oregon border in Del Norte and over to Lake County.
Wow, that does sound like a big job. And when I sent you an email a couple of days ago, I got an email back that said that you were pretty busy and weren't able to write any emails to anybody. So you've been pretty busy these days.
Right, because United Way's the hub of communication with all of those partners, plus we've got a very robust connection with the workplace community, with corporations and small businesses that are our funding partners. They're really the bread and butter and the heart and soul of our organization. They fund the good work and the community impact that we do in the region. And then, frankly, in addition to that, there's a lot going on in the provider community right now. And our Executive Vice President, Jennifer O'Donnell, serves as the chair for the Community Organizations Active in Disaster, COAD, while another one of our team, our Health Program Officer, Nicolette Weinsweg, is overseeing our 211 Sonoma.
All right, now you've mentioned the 211 Sonoma, and that's really, we have people who send us questions. We answer as many questions as we can. I have lots of questions here for you, but tell us what 211 Sonoma is meant to do for people who want their questions answered right away, both in English and in Spanish, I understand.
Yes, well, actually, our 211 service has the capacity to respond in 150 languages, but they can readily go to our website, 211 Sonoma, and find information through our website. In addition to that, they can call 211, and they will be connected with an English-speaking, a Spanish-speaking, or we have live call center staff who are fluent in other languages as well, who can answer their questions. In addition, they can text, and they can use a texting platform to be communicating with a live call center person as well.
What would they text? What number?
So what they would do is they would text to 898-211.
Okay.
Their zip code.
Okay.
So 898-211, and then in the message down below, let's say they text 95407. And when they send that message out, they'll immediately get back a response from a call center specialist, and they'll begin a dialogue, Q&A back and forth. The information that the call center staff will be providing is updated 24/7. We have staff who've been working in the Office of Emergency Services and in the EOC, in the Emergency Operations Center, since the beginning of this crisis. So all of that data is updated regularly. And so for financial assistance, emergency food, hot meals,
testing questions and questions about the coronavirus, did they call those numbers as well?
Yeah, absolutely.
So all they have to do is pick up the phone and really literally hit 211, just like for 911 be an emergency, 211 is for your questions.
Yes, absolutely. If you could imagine, when they open up the website, the first thing that they'll see on 211sonoma.org's website is just a button to click for food distribution, and then school meals, and then financial assistance. And those buttons will lead directly to resource pages. So
you're doing this a number of ways. You're doing it with the phone if you feel like you need to talk to a live person.
Right.
You're doing it on a text platform. You're doing it on a website.
Absolutely.
Tell me how this has been working. I mean, it must not be working perfectly. Have there been any choke points or?
You know, we did get a big surge on the 17th of March when the governor issued his shelter-in-place order for the entire state. There was a big surge in calls on that day, but we've caught up with that surge, and the numbers of calls have really leveled out now. In these past 20 days, we've served nearly 1,700 by text and call. And when you compare that to the first 2 months of the year when we served just under 4,000, that's pretty heavy call volume for those, you know, not quite 3 weeks. But we've got a fantastic call center team, and we have capacity to staff up when we need to.
Okay, so if your question is not being answered right now, watch the show between 7 and 8. And if your question is not answered, go to the phone, call 211.
Yes, that's great advice.
Okay, let me
yes.
start with some questions.
Alrighty.
How can we help fill needs in our community while we're sheltering in place? What are the top needs at this point? Is it sewing masks for hospitals, supporting the food banks, calling our congressional representatives to urge more funding for local government? Here's someone who wants to get involved.
So I'll just say this, you know, I think top priority for many of the providers in the community, the nonprofit community providers, many of those that Supervisor Gore mentioned during her interview with you, need support. They need financial support. And so imagine that this time of year, we usually have a lot of fundraisers going on. All of them have been canceled. This time of year, we're all thinking about our year-end fundraising because the end of the fiscal year is June 30th. We've had at least 2 crises in this fiscal year with the Kincaid fire and now this. So all of the organizations are really experiencing difficulties. So support your favorite nonprofit. If you were going to a fundraiser, go ahead and let them keep your ticket money. And then make an extra donation if you can do it to support the work that they're doing now, because nobody budgeted for 1 crisis in this fiscal year, not much less 2. Advocacy is genuinely critical. I think that what's going to happen now at the federal level is that there's going to be a technical correction to the bill that was just signed by the president, and there is going to be at least one more stimulus bill. So I would recommend checking in with Congressman Thompson's office, Congressman Huffman's office, monitoring their websites for updates on advocacy.
Okay.
And then I would recommend reaching out to the Volunteer Center in Sonoma County because they are in the lead, and I believe that they are the county's vendor. That's the one that maybe Supervisor Gorin was trying to remember. They are who is really in the lead with coordinating volunteer support.
Excellent. All right, here's another one. I'm a 61-year-old female massage therapist in private practice in Sebastopol. I closed my office when Governor Newsom ordered shelter in place. I pay taxes. You may not have the down-to-earth info here, but I pay taxes jointly with my spouse. I paid 2019 taxes. If I do qualify for unemployment under the relief program signed by Congress, how do I do that? I registered for unemployment on the employment website, but I stopped when it said as a self-employed person I don't qualify. So essentially this boils down to, is there help for the self-employed people in our county? There's so many of them.
Right. I think that this new federal legislation is going to result in changes in policy and regulations that will affect gig economy workers and self-employed people. So my recommendation would be to, go to 211 right now. Go to the 211 Sonoma website. And when you look for financial assistance and you click that button, it's going to take you to the SoCo emergency page.
Right.
And there is some direction there on how to file for unemployment. And I think that some of that instruction is going to be changing, evolving over the next few weeks as this new program of relief funding gets implemented.
Excellent. All right, when you and I were talking before, we talked about the Great and Day Labor Center, because
Yes.
these are people who work sort of on a day-to-day basis.
Right.
And I know that they had some information that they wanted the community to have.
Yeah, absolutely. So I was in a COAD meeting, a virtual meeting last week, and listened to the report from their executive director, Christy Lubin. They are in the process of doing some fundraising to support their service population. They opened an application a week ago Friday and closed it the following Monday. And over that weekend, their online application system received 900 applications for support. And I could imagine that that's probably true up at Corazon Healdsburg. I know that's true at La Luz Center over in Sonoma and CAP Sonoma. Everyone is looking at how to provide support to the most vulnerable in our community, and most particularly the people who are not going to be assisted through this federal stimulus package.
Excellent.
So again, direct support to those organizations will be a huge, huge help. You can also make a gift through United Way, the wine country, because all of the emergency and disaster relief funding that we're doing through our own website is being particularly targeted to reaching those vulnerable populations. That's what we did during the Kincaid fire and last year's flooding, and we're doing that again.
Okay, and very quickly, you said the VIDAS, the folks who do the legal work,
Right.
had some advice. Why don't we end with that?
So Vidas Legal Services is in the lead on the Sonoma County Secure Families Collaborative. They do removal defense work. The message from their executive director, Margaret McCabe, was please let people know that enforcement is actually still happening, and ICE is still doing enforcement in our community. So she wanted people to be aware of that. She also wanted people to be aware that the DACA decision coming from the Supreme Court, although delayed, is not looking like it's going to be favorable. So supporting any advocacy and any efforts by Vidas and Great and Day Labor Center and other community-based organizations that are supporting the migrant and immigrant and undocumented community would be especially helpful right now.
And DocuFund, I guess, would be one of those as well that you
Absolutely.
could absolutely support. Lisa Carreño, I really appreciate you coming on today.
Thank
I
you
wish we
for
had
having
more
me.
time to talk, and I hope we can have you back.
Thank you. I'd be pleased to come back. Thanks for having me, Steve.
All right, thanks, Lisa.
Take care.
All right, our next guest will be joining us via Skype. And the next guest is Supervisor Shirlee Zane. Now, Shirlee Zane, over the course of many years, has been an advocate for mental health in the community. And so we especially wanted to reach out to her and to ask her about resources that were available for mental health, about the things that people should be thinking about when we're trying to be gentle with our friends and loved ones and neighbors. And one of the things that Shirlee said was that she was getting a lot of emotional support from her horse, Lucy. So here's my interview with Shirlee Zane. I hope you enjoy it.
We're going to dive in. I have lots of questions from our listeners, but let's really talk sort of quickly and succinctly about how your lovely horse might be giving you comfort in this time.
Okay, tell me. Okay. Well, horses are wonderful because they have no pretense. They just, whatever they're feeling, it's all right there. And so that's really good because she can reflect either my anxiety or my calm, and she does both.
Here's the first question from a listener and viewer. I have grave concerns about both the physical and mental health impacts of closing parks and recreation facilities. Everywhere I've gone since shelter in place was announced, people have been respectful of the 6-foot distancing requirement. Exercise and recreation are absolutely crucial to human well-being, and especially for people living alone. It is essential to get out into the outdoor public spaces where at least they can see other people and interact with them again from a safe 6-foot+ distance. When will this restriction on our parks be lifted?
Well, I hope soon, but it wasn't my decision. It was the regional park director. And I think what was happening is that you were seeing an overcrowding in parks and that distancing wasn't being adhered to. I think also one of the major concerns is that you have public bathrooms in parks and drinking fountains. and people were, using the bathrooms. Of course, they needed to, but there was lots of contact, human contact. There weren't Clorox wipes involved, and it was really a dangerous situation. So I think when Marin closed their parks, it made it particularly hard on us in Sonoma County, because we figured that Marin County people would be coming up here, and our parks would become even more crowded. I took a hike up Taylor Mountain with my dog the day before we closed parks, or 2 days before, and I didn't know we were going to close them. I didn't even know we were talking about it at that point. And there were a lot of people out there really enjoying the beauty of Taylor Mountain. So I hope we reopen them soon, but our first priority has got to be to get past this really difficult time where we are dealing with a virus that's so easy to spread. And we just don't know who has it and who doesn't, because there are a lot of people who have it and they just don't show any symptoms. So out of abundance of caution and need to control this virus, the regional parks director and the director of emergency services and public health decided to close the parks.
Another question. How do you prepare to deal effectively and humanely with those who will suffer and need intervention for mental health when the news says there's not even going to be enough beds available for just the regular, first of all, for COVID, and second of all, for the rest of the problems, the heart attacks, the broken legs? So where does mental health fit in? I know you've been a champion of mental health.
I actually think this whole crisis with this virus is elevating the importance of mental health for all of us. And so I'm hoping that's going to be a silver lining behind the crisis. First of all, people need to take care of themselves and their loved ones and really concentrate on that self-care. I'm confident there will be enough beds for all of those things that the listener stated, because we are preparing to expand facilities right now so that we can have the people who are the most seriously ill be in the hospitals, but other people will have an opportunity to be in a healthcare setting. We're looking at hotels, we're looking at all kinds of different facilities right now and preparing for that surge that we are very concerned about. Meanwhile, there is lots of hotlines where people can talk. And those are free. And so by all means, utilize those. And hopefully you can put them up on your website. They are up on the county website. You can call the suicide hotline. You don't have to be suicidal. Maybe you're feeling anxious or depressed or desperate. By all means, there's counselors, trained counselors on that hotline. Give them a call. There's all kinds of virtual groups, support groups too. Lots of caregivers are struggling right now. Because they've had an additional burden, no respite. There are virtual support groups out there. NAMI has them, the Alzheimer's Association.
NAMI, the National Association for Mental Illness. Yes.
Mental illness, you can go to, but I would encourage the listeners to go to our website.
Which is SoCo-Emergency or?
.org, yes.
Okay.
And go to our website, you can find all kinds of links and resources. But there's right now, at any given moment, there's about 6 hotlines that people can call. 24/7 national disaster hotline. It's 24/7. So is the suicide line. So counseling is there. It is available. But the self-care is really important. And I just can't emphasize this enough. Social distancing does not equal emotional distancing. You need to stay connected.
Okay, thanks. That's fabulous. Now, here's a question that several people have had. What is happening to protect the Sonoma County homeless population? Is information being dispersed to them? And how is their mental health being taken into account?
We're absolutely doing all of the above. We have 8 public health nurses that are going out there and just dedicated to reaching the homeless. We're trying to get them housed in safe facilities. So we've requested 450 motel rooms through the state so that people who are homeless have a safe place where they can shelter and still have that distancing so as to not to contact the virus. There's a lot of efforts being done out there, and I guarantee you, they are at the forefront of our minds. The homeless, along with seniors, and seniors. The reason why we have to remember them is because this virus is really profoundly dangerous if you're a senior, especially if you have any type of pre-existing conditions, whether it's heart disease or diabetes or high blood pressure. So there's lots of efforts there. And every morning we get a debriefing from our emergency operations center, the supervisors, and I can assure you that our emergency operations center is doing a fabulous job.
Here's another question about testing. People
Yeah.
throughout the county are very anxious about testing, and that's making them worried and concerned. There's a reason that people, some of us are called the worried well. And even if you're sick, you may not be able to get testing. So what mental health resources might be available specifically to address people who really, really want to be tested and they absolutely can't be in the current climate?
Yeah. So, I understand the question is, how do I deal with this reality? First of all,
Yes.
there's more tests out there, but we don't have enough equipment,
Yes.
the swabs, things like that. We're waiting. The state's ordered, the feds have ordered. We're waiting for some of that equipment. So we hope that there will be a lot more testing in the days to come. But you have to have some pre-existing conditions and have the symptoms as well to get tested. You need to call your doctor, not to show up at the emergency room. So this is something that we have to pull together to do as a community, and to help address our anxiety over this issue is that, again, there's the counseling hotlines. I'll say that the counselors, the licensed therapists, are able to do regular both groups and individual therapy virtually. So the insurance agencies, if you're worried about whether or not your insurance would pay for that, it is being paid for. So if you do have a therapist that you've already connected with, by all means call them and make an appointment. Otherwise, the 24-hour hotlines are great, and there are family support groups, there are caregiver support groups, there are all kinds of support groups out there. But you do have to do a little digging yourself in terms of the phone calling. It's hard. We want to acknowledge that it's a very anxious time. I would really encourage people to spend time exercising in their neighborhoods, to eat well, to sleep well, to do things that normally you don't have enough time to do, whether it's playing ball with the dog or whether it's reading a book, listening to good music, but turn off some of the television, because it makes us a lot more anxious when we're constantly listening to these very traumatic and disturbing media and news lines. So please do. And I want to thank Sonoma County. Sonoma County gets an A in terms of how they deal with disaster. And people are really being supportive and really cooperating. It's not a normal way of living. It's called disruptive living. It is a disruption in every single way. And we acknowledge that, and we acknowledge the need to take care of ourselves, take care of our loved ones, and use the resources that are there.
All right, Shirlee Zane from the Board of Supervisors. Shirlee Zane is in her last few months on the board, and Chris Corsi is going to be taking that seat, and that'll be happening in the future. But for now, Shirlee has been wonderful talking to us about mental health. Now, if you're just joining us and you prefer to be listening to the program in Spanish, I want you to know that if you tune in to KJOR 104.1 FM, La Mejor, you can hear a Spanish version of this show on the radio while you're watching us. All right, now I'm very lucky to be joined by the county health officer, Dr. Sundari Mase. Sundari, I know you were on the front page of the paper this weekend, not your choice. You didn't go down to the office and tell them to put you there, but it's something that happened. But you have lots of news for us today, and I want to start out by telling us, what's new as of Tuesday, March 31st, 2020.
Great. I'm here to give the update, and I want to do what I usually do, which is just go through all the numbers for us.
Okay.
So first of all, globally, now we have about 857,000 confirmed cases, and the United States is going to the very top in terms of number of cases. We have about 43,000 deaths as of today. If you look at our national update, the total cases now in the United States are 163,539, and our deaths have risen to 2,860. This is a national data. Now, if you look at California, we have 7,477 cases now, with many, many cases in the Bay Area. And if you take a look specifically at the active cases, 7,268, recovered 60, and deaths, we have 149. Now, I really want to focus on really up-to-date Sonoma County case counts. In fact, this is hot off the press. We've had 12 new cases reported to us today, bringing our total to 85. And you know, this week we started giving some of the demographics and things that people have been looking for over the past several weeks. So I'm happy to report we can give that data now. So of our 85 cases, 71 are active. We have 13 that are recovered, and we have 1 death in our jurisdiction. If you take a look at these cases, where are they coming from? Well, we have 17 that are travel related, either domestic or international. 13 that, actually now there's 18 that are close contacts to other cases. And we have 13 that are community transmission, and some that are under investigation, 37. Now, you might ask, who's going into the hospital ever? And I knew this is a statistic people really wanted to have. So far, it looks like about 25% of our cases end up in the hospital at some point. Whether it's in the beginning, middle, or end, we're not quite sure. We could, of course, look at that data, but 25% are hospitalized. And how about age groups? Well, we had our first 2 cases in kids reported today in the 0 to 17 year age group. But the majority of these cases are happening in adults under 65. So we have 43 in the age range of 18 to 49, and 24, 50 to 64, and 15 in those over 65. And we can talk some later about why that might be. Split pretty well, male and female. And I think still people just need to know that we're having cases from all around the county in every region. I'm not going to go specifically into the areas, but
Sure.
But that's what's happening.
Okay, now there's some new orders that were released today. I know the 6 counties of the more populated Bay Area released some orders, and people were waiting all day for you to make some orders.
Yeah.
So let's have it.
Well, my team has been very busy over the weekend and today putting together the new order, and we are aligning with our other Bay Area counties that released their order. So what's new about this? Well, I really want to highlight some specific areas. There's a lot of little things that have been clarified, really because of the great questions we got from the public. So first of all, one of the new requirements for all essential businesses is that before this Friday, we would like them to create, or actually they must create, post, and implement a social distancing protocol for each facility frequented by employees or the public. And the essential businesses have to provide a copy of this protocol to all employees and provide evidence of its implementation when they're asked by any authority. So that's new, and I think it'll really help people remember what our social distancing recommendations are. We have added some really key businesses based on expanded essential activities. We have added that you may leave your residence to attend a funeral with no more than 10 individuals present, to manage any after-death arrangements or burials, to arrange for shelter or avoid homelessness, to avoid domestic violence or child abuse, to travel for parental custody arrangements, and to travel to a temporary residence to avoid exposing others to COVID-19. So in order for these things to happen, we need some additional essential businesses. For example, we need service providers like real estate agents or those people that escrow agents, notaries, people who work in title companies, in case there's some sales that are happening, funeral home providers, mortuaries, services to assist unemployed individuals with finding employment, and moving services in case you're allowed to move. The order does restrict all moves and really restricts them to essential moves that have already been previously planned.
Okay, and now tell me about dates. Have you extended out the dates?
Oh, yeah,
or we changed? That's the headline.
Very important, very important. May 3rd is, we've extended now this shelter-in-place order until 11:59 or 12 a.m., I would say, on it's May 3rd, 12 a.m., May 4th.
So it's another month, essentially.
Another month. And we
Okay.
chose that date because we didn't want to end it on a Friday, which would have been May 1st.
Sure. All right, let's dive into some questions.
Sure.
Testing. Are there adequate tests to test everyone exhibiting symptoms without restrictions? We have a friend who was running a fever and a dry cough and was told by Kaiser that she was not eligible to be tested because she did not have one system, which was the tightness in the chest. So do you have to have every single system in order to be tested by your healthcare provider?
Well, our recommendations are that anybody who has symptoms really should have access to testing. Having said that, providers are making these decisions, and we are prioritizing testing for those essential groups and criteria that I'd previously mentioned. Still, it's the same. It's people who are really ill, hospitalized, people who are healthcare workers, first responders, and people in congregate settings like the homeless, jails, skilled nursing facilities, long-term care facilities.
When you say that, what I hear, and forgive me, is that we don't still have enough tests.
We don't have universal testing for everyone.
We don't have enough tests.
We have the laboratory capability is there. However, the test kits, and we've been talking about these test kits a lot, they are swabs and the testing media that come together as a test kit. We have had definite limitations of those, and we're working very hard to getting those supplies, and we've put in numerous orders, and we've actually gotten a lot of those supplies. I want to point out that testing has increased quite a bit in the last week since I talked to you.
Good. I'm glad to hear that. Here's another one also about Kaiser. It says, my mother works at Kaiser and has seen Kaiser denying tests to symptomatic employees. What is the county's position on whether hospitals can refuse to test their employees?
Well, we give the guidance to hospitals that they should test anybody who's a health care worker who's symptomatic. This is a priority, and those folks are very high on the criteria because they could obviously expose others. So I don't know of this particular circumstance, but that's not our guidance to hospitals.
So as a health officer, you're only allowed to give guidance to hospitals. You're not allowed to tell them what to do.
Exactly. Okay. Hospitals decide on their own policies.
All right, here. In light of the fact that a mail carrier was found positive for COVID-19, should all the people on that carrier's route be tested? And what do you know about whether you can get COVID-19 from the mail?
Yeah, as we discussed before, COVID-19 does live on surfaces, and we think that solid surfaces that are frequently touched and by many, many people are a risk. About the mail, we just don't know. And what I want to assure people is that we are investigating the situation in public health to ensure that there aren't more cases in that setting. And we are taking the necessary actions to ensure that we try to safeguard the community.
What about this hot spot that's so upsetting on the Santa Rosa police force where they lost a policewoman today? Why would there be 8 cases out of a force of 170? Yeah,
first of all, I know everybody's aware, and it's such a sad loss, and it's very, very sombering to think about this. But yes, that person was a Napa County resident, a police officer who worked in our county. So
20-year veteran.
We're really feeling the loss.
And why on the police force?
Because they work closely together, and they have events together as well, trainings, these sort of things. And so there had been a lot of exposure amongst people even after they were ill. And so we found that there are 8 persons associated with this who were police officers, and I think the police department has come forth and released a lot of details in terms of the press conference. So we actually, in response to this, we tested a large group of the Santa Rosa police officers, and we didn't find too many additional cases. So of the 8, 2 were detected by our mass testing of police officers.
Excellent. So here's something about seniors who are anxious about their lives, especially those living in board and care homes or convalescent homes. If a senior in a home of any kind gets sick, will they be able to be taken to the hospital? Some seniors are being told, sorry, you have to stay here, we can't take you to the hospital. And once a senior recovers from COVID-19, does the county have any plans to insist that they are taken back into their former setting? There are so few places that take Medicaid or are in any way affordable. And what about mandating that these facilities set aside places for the returned to quarantine?
Boy, that's a lot of questions in one.
But it's the same question,
Same
essentially.
question, essentially, yeah. So there are really good guidelines that have been put out by CDC and CDPH that address all of these areas. If someone's really ill in any situation, including in a long-term care facility or skilled nursing facility, they need to be evaluated in the hospital at the emergency department.
So even if someone says, oh, we're not going to take you to the hospital, that's not true. The hospitals will take these people
That should
in.
not be the case. That person should be evaluated just like anybody else sick who's coming into the hospital. Of course, in the hospital, they'll wear the appropriate protective gear when evaluating the person, and then that person may be hospitalized.
Sure.
Now, if they are diagnosed as having COVID, they shouldn't return back to that skilled nursing facility or long-term care facility until they are negative for COVID. They've not symptomatic any longer, and they're safe to go back into the setting. So I think if someone had a milder form, and they weren't going to be exposing others in that facility, potentially they could be isolated within the facility. Now, there also are plans that if the person can't stay there, we're working on these alternate care sites that we've discussed before where we could move people.
Excellent. And I have one last question for you. How can you expect normal citizens to follow the shelter-in-place order when county officials are not required to do the same?
Well, actually, the health officer order applies to every single person in Sonoma County, including government officials. So this just underscores the importance to follow the shelter-in-place order.
All right, Dr. Mase, now I understand that there will be more modeling coming, and in the next day or two, you'll be letting us know how many fatalities, morbidity, much you'll be expecting in Sonoma County.
Well, not in the next few days.
Okay.
Next few weeks we'll have that
Okay,
data, but I do want to say we do have preliminary modeling, and we'll be putting this on the dashboard.
Okay.
Just in brief, the shelter-in-place order seems to have been very effective in flattening the curve.
That's great news. Thank you so much for that, and we look forward to seeing you next week.
Yes, thank you so much.
Thanks. All right, now we have, earlier today, I was able to speak to a doctor in New York City, and the doctor turned out to be a pulmonary specialist, someone who is a lung specialist, and he had just gone through a bout of COVID-19 where he barely escaped with his life. And he and I were able to talk about this, and I'd like you to see that interview right now.
You and I have known each other for a little over 50 years.
Pals from high school.
And I remember about a month or so ago, we started to see some news on Facebook, I think posted by your daughter, that you were in the hospital and she wasn't sure whether you were going to pull through.
Yeah, it was a time for my family. My wife and I were both diagnosed in early March. My course was a little more rocky. Fortunately, my wife was asymptomatic through most of it, but I had fever to 102.8 for a few days and realized it wasn't an average virus. I had an intuition that I had it, truly. And I learned that the test was available at a local hospital. I went over there really just to be tested, and they decided to do a more thorough evaluation. My lab work was really quite bad. CAT scan showed a bilateral pneumonia, and I was admitted.
Bilateral meaning it was in both lungs?
Both lungs, correct.
So you were admitted to the hospital. What hospital was that?
Lenox Hill. I owe them my life. They were wonderful doctors, nurses, X-ray technicians, food supply, everyone. It's a group effort. It does take a village.
Did you do you think, any special consideration because you're a doc?
Well, I am on staff there, and so I wasn't shy about saying, remember me, but they knew me. And it was actually very fortunate that I went over there that day because I crashed that night.
Crashing what does that mean? Is that a medical term?
Yeah, I'll go for it. 103.7 fever, a blood pressure of 80, and oxygen levels that were really very close to requiring mechanical ventilation. It was a very Kubler-Ross kind of moment where I wasn't actually afraid. I felt I was sort of floating, wasn't looking down at, as people have commented, but I felt with great peace. I really wasn't stressed until the following day when it was welcome to the rest of your life. And I had all of the fever pains, muscle pains, bone pain, clenching headache, nausea, and I was slammed. And my infectious disease consultant arrives and says, "You're a healthy fellow. We really don't have a beaten path as to what therapies are correct. We're going to let you go through this, watch it closely, but we're not going to empirically begin therapy." I was a bit like a deer in the headlights, but not wanting to run my own management of said, of course. And 3 or 4 days later, crashed again and had another sort of bad run, at which point they gave me a cocktail of medicines, including an HIV therapy, the Plaquenil that everyone's talking about, dihydrochloroquine, and an interleukin-6 inhibitor for something called cytokine storm, which I was undergoing.
What is cytokines?
Cytokines are chemicals that are not stored in the body, but are produced upon some event. So pretend you cut yourself a modest cut. The cytokines might even be elaborated locally to kill bacteria. And that's why most of us get away with a modest cut without much to do with general care. When you are confronted with a very serious illness, and as I mentioned, sepsis, burns.
Sepsis meaning?
A blood-borne infection.
Okay.
You have this dysregulation of cytokines, and there are many. And that's when you feel what I was just explaining, this panoply of various symptoms that we really generally don't talk to patients about because they're so sick, there's really not much communication. But there I was with my infectious disease consultant debating whether I was in cytokine storm, and it was curious. So I was.
And again, the cytokine storm, meaning that your lungs are on fire, your bones are on fire, everything inside you
internally
feels like it's on fire.
That's right. Internally, you're just really sick. I was having a clenching headache, like a toothache throughout my whole head. I had profound nausea. My bones and muscles hurt in ways that I don't even know how to describe. I was breathing at 30 times a minute, but saying to her, I don't think I'm in cytokine storm. I mean, we know what that looks like. That's people who are crashing and burning. So it was a curious moment of no longer being as toxic as I was with fevers, but still being as sick as I was with this other issue, which ultimately went away.
And thanks to my high school classmate, Dr. Jonathan Raskin, for sharing some of that. Lots and lots of folks in our country will be having this disease. As many as 200,000 or more will be dying over the next few months, and that's called the best case scenario. So that's where we're at right now. Now, I hope many of you have been able to join us, if you're a Spanish speaker, by listening to 104.1 FM La Mejor. At 5 p.m. on Tuesdays, there's also a completely Spanish town hall that's broadcast by radio station KBBF FM. And on today's KBBF town hall, there was talk about the fact that there is no cost for testing. Nobody who has symptoms and whose health provider says that they can be tested should not get testing for any reason, especially because of any worry about cost. Most insurance, if you have insurance, will cover the testing, but if someone does not have insurance, they can still be tested at no cost, and the undocumented in our community can apply for Medi-Cal in order to receive medical attention if they test positive. So we should all understand that nobody in this community is going to be allowed to not get health taken care of. Nobody in this community is going to be allowed to not get the food they need, and these are some of the most important things that all of us can do. Dr. Mase talked about the fact that the shelter-in-place order is going to be extended until the first couple of days of May. If someone travels outside of the Bay Area, this is new information, and we can check this with Dr. Mase when we can. They're going to be requested to quarantine for 14 days upon their return, and unless a person is traveling by demand, perhaps to work at a hospital or to some other relevant, essential business. So this is our 4th town hall. We've been doing these with the county now for 4 weeks. We've been very, very lucky to get Dr. Mase to join us, and we hope that she will be a regular guest week by week. We'll also be joined by several other guests as we go. I want you also to know something on a personal note. I'm going to be flying this weekend, God willing, to Baltimore. I'll be sheltering in place there with my wife. I'll be working remotely from home, and Adia White, the assistant news director here, is going to be hosting the next few town halls. We really hope you will join us. We'll see you next Tuesday at 7 p.m.